For thousands who toiled at Ground Zero in the days after the 9/11 attacks, a deadline is approaching. Since 2011, federal programs have offered substantial aid to people with illnesses potentially linked to the toxic dust from the World Trade Center collapse. But those programs will expire next year, and today dozens of rescue workers and members of Congress gathered at the World Trade Center site now to fight for an extension.
Those who put their lives on the line, those who suffer these terrible illnesses, those who may in the future suffer illnesses from the work they did down here, there's no doubt at all. They should get the health care, they should get the monitoring that they absolutely deserve.
Congress initially limited the programs because of concerns about the massive cost. The funding right now is scheduled to end in October 2016.
Well, smokers, listen up. You could soon be banned from lighting up in hotel rooms in...
You're watching News 12 Long Island. We are live at 5:13. Well, a plea tonight at Congress to extend an act that provides health benefits for 9/11 first responders who were sickened while working in the toxic debris at Ground Zero. News 12 Long Island's Leah Mishkin has that story.
I was up on the pile, and we moved the steel beam, and this green smoke came out of the ground. And that's when I took a deep breath, and I was with a couple of firemen, a couple of other firefighters from another county. And we all fell to the ground because it cut the air off, and it just burned.
Rescue worker Ken George says he came down here after the attack every day for more than 4 months. Today, 14 years later, he says it's difficult being back in this spot, not only because he suffers from health conditions, but because he suffers from PTSD.
Sometimes I sit there and wonder what would have been easier, to perish in the buildings or sit and suffer the way I am now.
George says since search and rescue efforts at Ground Zero, his medical conditions have worsened. He says without the James Zadroga 9/11 Health and Compensation Act, he would have to pay more than $6,000 a month in medical bills, a cost he says he would not be able to afford.
And then you would have to pick and choose what do you need for this month or for that month. I mean, that's no way to live. You know, when the towers got hit, they sent us down there. You know?
But the Zadroga Act that was signed into law in 2011 is set to expire next year. That's why today at Ground Zero, congressional leaders and survivors gathered together to support a bill that would extend benefits indefinitely.
Really, it's a national disgrace if we don't do it. It's not a New York issue. It's not a New Jersey issue. It's an American issue.
Congressman Peter King says more than 70,000 responders and survivors are at risk of losing care and support provided under the Act. He says the bill he is co-sponsoring would make sure the Victim Compensation Fund and the World Trade Center Health Program are made permanent. In Manhattan, Leah Mishkin, News 12 Long Island.
Well, today, dozens of city firefighters were on the island to remember one of their brothers who died.